Well, I'm really grateful for this opportunity to join you in this medium at your summer school. I was hoping to have the opportunity to come and visit you in person this year. I was just recently teaching at a university in Hanoi, Vietnam, for a couple of weeks, actually 4 weeks. I was there for a while, but I had to return to the US for some things that were happening here. And so I'm very grateful for the opportunity to be able to deliver this lecture and this class here by Zoom through this interface. So please do feel free to let the monitors know in your room if there are any questions, and then perhaps they can be added to the chat, or those questions can come to me in another format, because I definitely want this class to be interactive if there are things that are coming up for any of you. So thank you again for the introduction. As mentioned, I'm currently a professor of economics at Colorado State University in the United States. I actually have a professorship as well with the Environmental and Occupational Health Department, which is part of Colorado School of Public Health. It's kind of a courtesy appointment that I have jointly, concurrently with my main appointment in economics. And so I'm coming to you today as someone who has two hats. Right? One hat in terms of economics, but another hat in terms of environmental and occupational health. And so I think that this topic is really a great mix of those two things. But as mentioned already, in terms of my credentials and my background, to be addressing you today, I did do my bachelor's in economics at Johns Hopkins University and my master's and my PhD at Stanford University in the United States. And while I was there, I specialized in public economics and in development economics. And I think that that's very relevant to our topic today, because a lot of the things that we do in public economics are based on welfare foundations, which we'll talk about a little bit today. And then in terms of development economics as well, there are all kinds of questions that pertain to different settings where health and public policy may be challenging in some environments. So I'm bringing both of those backgrounds to you here as well. I also have research affiliations, not only with the Colorado School of Public Health, but with our Regional Economic Development Institute, with the Water Center, Colorado Water Center, and with the Data Science Research Institute, which are also some institutes at Colorado State University. And I'm currently the pilot program director for the High Plains Intermountain Center for Agricultural Health and Safety. So that's yet another hat that I'm going to be wearing as I go through this, because one of the populations that I have studied quite a bit in my own research are U.S. farm workers, who tend to come from international origins, tend to be a binational population, and have certain vulnerabilities that are really relevant for studies in the agricultural health and safety realm. I'm bringing all of those things. I think it was also mentioned already that my background is in applied microeconomics and disadvantaged populations specifically, so including labor markets and including workers who maybe have more of a propensity to have disadvantages in terms of their health and their safety at work. So those are things that I've been studying. Themes of my research more broadly are in labor markets, inequality, and race and ethnicity, in agricultural labor markets, in migration and immigration, and then in public health and development economics broadly. And then I also wanted to mention, just by way of introduction here at the beginning as well, that I have a background in terms of teaching microeconomics at a whole bunch of different levels, and then also econometrics and public economics at some different levels, and development economics. And so I'm going to be bringing some of that teaching background into what I have to say as well. And I know that some of you have had a background to some extent in economic theory. though perhaps there's some variability in the room as well in terms of what you studied. And so I'm going to be taking some things back a step that might be a review for some, but also might be some new material for others in the room. So what to expect in these sessions? I'm actually going to be doing 2 sessions today that are almost back to back. So we'll do the first session and then we're going to take a break and come back for the second session. But in the first part, roughly, what I want to talk about is how to think about labor as being an input in economics, but also being real world people. So I'm going to be thinking about labor, how we think about modeling labor generally, and then think about what we might be getting wrong in the way that we have been traditionally modeling labor in economics, or what might be a little bit incomplete. And so for that, I'm going to think back to our foundations from microeconomics and build off of some of those things that you might see in a traditional course. And then I want to think about worker health and safety and how those topics are thought about within economics. And for that, I want to go through an application from my own research that pertains to immigrant agricultural labor, which is primarily low-skilled labor in the United States. But I want to also think about this as being representative more broadly and having some applicability to some other industries and sectors as well. And then in the second part of this kind of 2-part lecture series here, I want to think about ethics in economics a little bit more and think about how that pertains to worker health and safety. And I want to go through a little bit of a case study application that's drawn from the case of sweatshops, looking globally. And so I'll be drawing on my own background in development economics, but also in terms of something that you may have seen in Indonesia and in other countries as well, that is very relevant in a global perspective. So I'm going to be thinking about those things. So as promised, I'm going to start with some foundational material and really think about what we learn in microeconomics. And so what we learn in microeconomics is that we think about production decisions of a firm as really being 3 big steps. And so if we're thinking about the theory of a firm, we usually think about the production technology. We have some kind of function that is moving inputs into outputs, right? So we have this function that transforms our inputs, which might include labor, capital, raw materials, anything else that we have access to that we're using in the production process. But all of those inputs, and we're transforming them into outputs, right? So that's the idea of our production technology, how we get our inputs into outputs that we can then take to market and be selling in a market. And then we have cost constraints. And so when we're thinking about cost constraints from the perspective of microeconomics, we're also often thinking about inputs into the production process and the cost of those inputs. And so we have these expenditure bundles, and we have this expenditure that's happening on labor. We have this expenditure that's happening on capital. We have this expenditure that's happening on raw materials and on anything else, right? And so we're thinking about how we might have a fixed amount of money, or we might have an objective of minimizing our cost subject to some kind of output that we want to achieve, right? So there's a dual problem there. And then the third step here is thinking about input choices. So if a consumer is constrained by a limited budget, similarly, a firm might be constrained or concerned about the cost of production and also the prices of labor, capital, and other inputs, right? So we bring together whatever the technology is and whatever the cost constraint is, we bring those 2 together, and that's going to ultimately determine in our models an optimal input choice into a production process, right? The optimal amount of labor versus capital versus raw materials and anything else that we have in this space. So the theory of the firm overall, which I just described in these 3 steps, is an explanation of how a firm would make a cost minimizing production decision and then how its cost would vary with its output. And so I want to think about those three steps kind of again, but one by one. And so when we think about the technology of production, we're usually in microeconomics also talking about factors of production. And so we use the term factors of production to talk about inputs into the production process. And we can divide our inputs into these categories, usually of labor, of materials, and capital. And labor, which we're going to focus in on today, sometimes we kind of think of labor all as being the same, and we have labor units. But other times we maybe divide labor into a couple different groups. And we might divide it, for example, into skilled workers, which might be something like an engineer, and then an unskilled worker, which might be something like an agricultural worker, which we'll see in our example. But we could also think about the firm's managers and their entrepreneurial efforts as entering that labor as well. So our labor is not necessarily just one homogeneous category where everything's the same. We could have a degree of heterogeneity within that labor, where we have different groups of labor, for example, and we can model them separately, right? So sometimes together and sometimes separately. In terms of materials, we might be thinking about things like steel and plastic and electricity and water and goods that the firm buys and transforms ultimately into the final products. So anything that might be an input or then an intermediate product on the way towards a final product might be included here. And then capital, we're often thinking about land and buildings and machinery and other equipment and inventories. We might be thinking about all the computer systems, computer workstations, things like that in terms of our capital. So we have all these factors of production that are entering whatever this equation is that is expressing our technology of production. And then we often build up this production function. And so we think about the production function as determining a quantity, that's our output, and our quantity is a function of those inputs. And so in this example here, our inputs are being restricted to just capital and labor, just to make this an easier problem in terms of a couple of dimensions we can graph, but we could definitely put in materials there as well. But the ultimate idea of the production function, that it's describing what's technically feasible when the firm is operating efficiently. And what we mean by efficiently is we're thinking about a firm that's using its inputs in a particular combination that's as effective as possible, right? So there are all these different possible ways that the firm could use capital relative to labor. And then we're thinking about them working in an efficient way, right? And that's what's being represented by the production function. When we're thinking about the distinction of labor versus capital, something that you may remember from any past economics classes that you have taken is that there's a distinction often given between the short run and the long run. And for the short run versus the long run, there's usually not a set period of time that we're thinking about. So we usually don't say, oh, the short run is 1 year. We don't know how long of a period of time that is, but we think of the short run as being whatever period of time we need so that quantities of one or more of the production factors changes, but not everything. Right? So the short run is a period where one or more of the production factors is something that cannot be varied, is something that is fixed. And then in the long run, that's the amount of time to make all the production variables, inputs variable. And I mention this because we often think of this as the distinction between labor and capital. And we say, you know, our labor is pretty flexible. We can ask our workers to stay an extra hour at the end of the day. We can ask them to go home early, right, if we don't have any work available for them at that day. And so we can adjust labor pretty immediately. But something like capital, if you're thinking about all the computer systems or something that you need, we may need to go and order those computers and bring them in. We may need some time to set them up, right? And so getting all of that up and running and working maybe takes a longer period of time. And so we often think about labor and capital as being different along that margin of time, in that labor is this thing that's very, very flexible for what we're thinking about. Now, in our economic modeling, we usually talk about things like average and marginal products, and we think about an average product as adding up all of the output and then dividing by the number of units. And we think about a marginal product as really isolating that last unit of output as a function of a marginal unit of our input. So sometimes we can think of that in terms of, mathematics and calculus and derivatives, or we can think of it algebraically, just in terms of a small change, like a 1 unit change, and what that next unit of output looks like. But the point is that we do all of this in terms of not just capital, we do it in terms of labor. And so when you think about labor as being real world people, and then you think about labor in terms of how we are traditionally modeling labor in our economic theory, we're usually thinking about our labor here in terms of its quantity divided by our labor amount, our change in quantity for a change in labor amount, right? We're using all of these kind of mathematical descriptions, which are a little abstract and are a little moving away from thinking about people as being people. So I wanted to make that point, that we use a lot of equations for a lot of the mathematics here, but it's a little bit artificial, right? We're trying to come up with these models that are doing the best that they can to teach us something about the real world while not being too mathematically complex, right? We're trying to do a balancing act over those things. But while we're doing that, we may be thinking about workers in a somewhat artificial way, right? So we're thinking about workers as being inputs into the production function. We're thinking about labor translating input into an output. And mathematically, we're thinking about labor in the same way that we thought about capital. So something like a computer system, right? We've reduced all of our people into the same as a robot, right? Is one way to think about what we've done with workers in our economic models, right? So workers are also real people, and as real people, when we bring in the topics and start thinking about ethics, for example, right, we may want to think about the well-being of individual workers, also the individual managers and the owners of the firms. We want to think about all of those people, and the government workers and government agents as well, right? We want to think about the people, but maybe we want to treat them in a way that's something that's larger than what we've done in these economic models, right? And so a lot of times when we move into health and safety implication, that's another place where our workers are different from our capital, right? So our computer's not going to get sick. Our computer might get damaged, right? And then we might replace it. But we maybe don't want to talk about workers in that same way as, oh, they got sick, so we just replaced them, right? We may want to think about people as people and care about people as well. So it's kind of an interesting intersection to think about what we do in our models and then think about how to add an ethical lens to some of these models. Right, so we're going to come back to that idea of what we've done with our workers here, but I also want to give you a little bit of a summary of some other microeconomics. And so this is jumping around a little bit in what you may have studied in the past, right? Or it's giving you a broad overview of some of the things that happen in this discipline. So I want to think about markets as well, because ultimately, our workers, even if they're an input to the production process, right, this is all part of market activity. And so in our markets, we're often thinking about bringing together our production functions. And so this is a description of our our production functions, which we described before, but a graphical treatment of our production functions. And we could think about things like slopes here. We could also think about combining this type of graphical analysis with the cost side that we alluded to before. And so we can think about all of those combinations of labor and capital that would be equal to a given cost. And so this is what I meant by there being a wage times labor, this amount of expenditure on labor, and then maybe a rental rate of capital times capital, so the amount of expenditure on capital. But this is ultimately just an equation for a line, and so it's going to have a constant slope. And so when we bring our two parts together, right, of this theory of a firm, part of our function here, we're going to have our, in the red line here, our picture of our production function. And then we're going to have in the blue lines here some pictures of these cost constraints. And we're ultimately trying to shift these cost constraints inward until we find a tangency, such as point A, which is a graphical depiction of what a minimum cost output combination may look like, right? And we come up with labor and we come up with a capital that's optimal there. Now, when we take that for our firm side, we ultimately drop this firm side into the market itself. And so we were saying that we want to think about markets and we want to define markets. So a market is a collection of buyers and sellers, right? The sellers are those firms that are minimizing the cost of their production and then bringing that production to the market. And the buyers are going to be the consumer side of the market. We didn't say anything about consumer theory, but consumer theory looks a lot like producer theory. It's just coming from the perspective of buyers in our economic modeling. And ultimately in our modeling, we bring these pieces together. We bring together the buyers and the sellers through their actual and their potential interactions. And we ultimately determine a price of a product or a set of products from that collection, right? So if you remember supply and demand analysis, we've had a demand curve and a supply curve, and we're looking for an equilibrium, right? And the demand side is telling us all this stuff about the buyers. The supply side is telling us all this stuff about the sellers. And we're bringing the two things together to find an equilibrium. In order to examine a market, we have to define a market, right? And so we usually think of a market definition as being that determination of what should be included in any particular market. Now, when we describe our markets, we could describe them in economics as being either competitive or non-competitive. And this distinction is going to matter for some of the welfare results that come out of this. So a perfectly competitive market is a market with many buyers and sellers, so that there's no seller or no buyer that has a significant impact on price. We're thinking about there's so many buyers in the market that no individual buyer by his or herself can really bid down the price, right, of a product by his or herself, right? So you might think about a market scenario where you have a whole bunch of different vendors that are selling the same thing, and they're all kind of next to each other or within a reasonable distance of each other. And when our buyers show up, they want to go to the lowest price group, but all of this, the prices are converging on the same price, right? In what we would describe as an equilibrium, because there are so many buyers and so many sellers in this market, and we're dealing with some kind of product that you could purchase from more than one place, right? And so that's what we think of when we think of a perfectly competitive market. And there's a lot of markets out there that are maybe not perfectly competitive, but are close enough that we use this as a modeling framework for them, right? As an approximation for what occurs. But then there are also some markets where there's something different that happens in terms of market power. So maybe there's a monopoly and somebody has some degree of price setting ability that's very different from what would occur in a perfectly competitive market, right? And so a non-competitive market would be that type of scenario. And maybe our firm by themselves or jointly with another firm could affect the price. That would be a non-competitive situation. So those market terms are going to come back to what we're thinking about in some of our welfare economics. But before I jump to that, I just want to remind you also of definitions from economics about what is positive analysis versus normative analysis when we're thinking about economic decision making. And so when we think about positive economic analysis, we're thinking about cause and effect relationships, right? We're thinking about if we adjust this price, what impact is that going to have on the quantity being traded, right? Those types of questions. When we're thinking about normative analysis, on the other hand, we may be supplementing our discussion with value judgments, right? We might be thinking about questions of what ought to be, and we're thinking about determining policies, right, based on some kind of judgment call, judgment valuation, right? And so the normative analysis is actually something that's very tightly woven with some of the concepts of welfare economics, right? Because we ultimately have to make some value judgments about what we value as society before we decide if we want to engage in any activity in a policy sense that might be redistributing resources from one group to another, right? So if we want to invest in something like worker health and safety, right, that's going to be costly. And so we're going to need to make a normative decision to invest in that instead of investing in something else. Somebody's going to have to make a value judgment, and maybe that's voters in a population, maybe that's some kind of central government, right? Maybe it's some kind of regulatory agency, but it's somebody who has to make those value judgments, right? Both of these are pieces of economics and of economic analysis, and they're both relevant to discussions of labor markets as well. So I've so far reminded you what happens in producer theory, and I've gone ahead and reminded you a little bit about competitive versus non-competitive markets. And then I've also reminded you of the definitions between positive and normative economic analysis. And bridging all of those pieces together, kind of something that comes up more as summary material in a microeconomics class, is that if we have competitive market trading and we have a result about a competitive equilibrium, right? So we're thinking about this scenario with lots of buyers and lots of sellers. We're not thinking about the monopoly case, right? We're putting that monopoly case to the side at the moment and thinking about this baseline case where we have lots of buyers and lots of sellers coming together in a market. And we have this result that a competitive equilibrium from that process ends up being Pareto efficient. And when we think about Pareto efficiency, we're thinking about that state of the world where there's no way to make anyone better off without making someone else worse off, right? No way to make somebody better off without making someone else worse off. That's our definition of Pareto efficient. And so we have this result that competitive equilibrium trading is going to result in this definition of efficiency. And that's sometimes referred to as the first theorem of welfare economics, or sometimes as the first fundamental theorem of welfare economics. And when we think about defining what is welfare economics, it's a normative evaluation of markets and economic policy. A normative evaluation of markets and economic policy. So that word normative is coming out here as well, right? This idea of we're going to have to supply some kind of value judgment here in order to make an evaluation and analysis of the markets that we're thinking about and the proper economic policy. right? So this first theorem of welfare economics says that if we have this competitive market trading, right, then all of the mutually beneficial trades will be completed, and the resulting equilibrium will result with a state of the world where there is no way to make somebody better off without making someone else worse off. So we've achieved that definition of efficiency. But that definition of efficiency, it's very nuanced. And what I mean by that is that it's very different from what we might think of in terms of equity and an equitable allocation, because it would be perfectly economically efficient, perfectly Pareto efficient to have a state of the world where one person has everything and another person has absolutely nothing. Right? So one person has all of the resources, and there's another person in the economy who has absolutely nothing, can't even eat, doesn't even have a little bit of money to get some food to eat, right? Why would that be Pareto efficient? Well, there's no way to make that person who's starving better off without making someone else worse off, that person who has everything. Right? So we have this really, nice result in welfare economics that says that leave a market alone and let there be competitive equilibrium trading, and we're going to have economic efficiency. And that sounds like it's a really great thing. And a lot of times it is a really great thing. But it also allows for the possibility that we end up with something that is so unequal, right, that somebody really can't survive and somebody else has all of the resources. I wanted to put that out there as a limitation of that result. And so there's actually a second theorem that kind of addresses that at least a little bit and says that a competitive equilibrium can sustain every point on the contract curve. And the contract curve is that curve that represents all of those different Pareto efficiencies. So all of the infinite number of possibilities of allocations where you have that economic efficiency condition, where there's no way to make somebody better off without making somebody else worse off. Any one of those points could be sustained as a competitive equilibrium if a couple of assumptions hold, right? And that's what we state when we talk about the second theorem of welfare economics. Right? And the second theorem of welfare economics, or the second fundamental theorem of welfare economics, tells us that redistribution does not need to conflict with economic efficiency, right? There might be a way to have efficiency, but also have something that we think is more equitable. Formally, the second theorem states that if our individual preferences are convex, so there's some mathematical conditions on the forms of how we describe preferences, but within the realm of economics, this convexity assumption is basically just the standard shape that we often think about in our microeconomic books. And so we put this a little bit of a mathematical assumption on here, but then we can show that Pareto efficient allocations, any point that are on the contract curve, can be a competitive equilibrium for some different initial allocation. And that's a really powerful statement because it tells us that if we can go ahead and redistribute things at the beginning of time, right, before any trading starts happening with the competitive market trading, then we could actually force an economy onto a different point than the one that it would naturally tend to, right? Which means that we could pick one of these infinite number of points that are Pareto efficient, and we could pick one that satisfies some kind of equity rule that we want to impose, and we could force the economy to converge onto that type of a point. So that sounds like a very promising direction, right? It sounds like a promising way to balance some of these equity and efficiency concepts, right? And maybe superimpose something that's more ethical into our microeconomic framework, right? That seems like it's a way to enter. And so the theorem itself is telling us any equilibrium that we deem to be equitable could be achieved by some kind of distribution or redistribution of resources among are individuals in the economy, right? But, right, the caveat here is that if we do want to go ahead and redistribute income, right, we may be engaging in a costly behavior through that act of redistributing income, because we may need to tax people and then transfer people and hire tax workers to move the money and to run the audits and all the regulatory pieces. And so all of that could be economically costly as well and move us away from efficiency. So that's a caveat. Another caveat is that the title of all of this said perfect competition. And we acknowledged at the beginning of this that we might have perfect competition, but we might have something like market power, like a monopoly market. And so this is not going to be applicable in all cases, but it certainly gives us a starting point in terms of where the field, the discipline of economics are, where it is, and then how we might think about ethics and equity as interacting with that model, and how we might think about developing a model to answer some of the questions that take more of an ethical lens. Right? So imposing ethics, we want to think about that efficiency piece in our traditional modeling, but we also want to think about equity. And we ultimately, while we do this, we want to think back to workers, because we're going to think about worker safety as an example here. And so we want to think about how we've kind of put workers in our model by thinking of them the same way we do as a computer system, right? We haven't thought of them as real people. We've thought of them as inputs into the production process, and only existing as inputs into the production process, right? So we have a bunch of different themes and different pieces of microeconomics that are relevant in some different ways to this discussion. So when we think about worker safety and its economic valuation, we might want to think about that Pareto efficiency, that value of efficiency, and any social surplus that's associated with our outcomes in a labor market equilibrium. But we also might want to think about how there is social surplus associated with having healthy work as opposed to having unhealthy work, right? Having work environments that are safe and healthy, where workers are valued and are able to work at their maximum capacity, right? And at a capacity that they're in a capacity where they're receiving some of the gains associated with work as well, right? So we have social surplus could be maximized with a healthy work environment as opposed to an unhealthy work environment. And some of that social surplus may go to workers. Some of that social surplus may go to firms or to managers or to owners of the production operation, right? It's going to be split up, that social surplus, and it may be split up in an equal way or a less than equal way, depending on the market parameters. So as we continue to proceed through this, we want to think about some research that's related to worker safety. But we also want to think about policy related to safety and how this necessarily is going to involve economics that's not just positive in nature, those cause and effect relationships, but this is necessarily going to involve normative economics as well, where we have to impose some kind of judgment call on top of this. So I want to kind of take a step back and move into something a little different, since we've done a lot of heavy theory here in the first half hour or so of this presentation, right? We don't want to spend all of our time just thinking about heavy theory, but we want to think about the application here that really matches the theme of what you guys are studying in your summer school program. So I want to think about health and safety of labor in economics, and I want to think about this through an application and through a case study. And I mentioned before that in some of my own research, I've examined the case of US farm workers. I've actually studied farm workers in a lot of different ways from a public policy perspective. So I've thought about workers in terms of educational outcomes, in terms of welfare payment outcomes. I've thought about child labor in some cases. I've thought about different aspects of pay structure and different things that pertain to immigration policy that may relate to outcomes of specific groups of workers as well. But in recent years, I've been studying some aspects of health and safety specifically. And as I mentioned, I have this affiliation as the current pilot program director for the High Plains Intermountain Center for Agricultural Safety and Health, which is really not an economic unit. It's a unit that's very multidisciplinary of researchers who are coming together to think about how we can improve health and safety, minimize accidents, minimize deaths associated with agricultural work, which tends to be low-skilled labor and tends to be paid very low wages relative to other things within the United States in terms of work, and which has a tendency to have large immigrant populations in those units as well. So I want to think about health and safety vulnerabilities, and some of the things that I've thought about in my own research have been field sanitation. And what I mean by that is, are there access to toilets? Is there access to clean water? Is there access to drinking water and hand washing water that's available to workers at their work sites? And especially, and this is not just an issue of sanitation, but it's also an issue that has to do with some of the chemicals that are used in U.S. agriculture that end up getting on workers' hands and their clothes. And if they don't have access to clean water, they're not able to wash some of that away. And there are all kinds of health implications associated with that as well. So that's one area that I've been studying. Another that I've been studying concerns housing structures. And if you have a population that is largely migrant, moving from one farm location to another, and being provided housing on the farms, that housing that's being provided may not be the best quality housing, and there may be sanitation and water issues in that housing itself, but that housing could also be associated with different things like contagion. And that became very relevant, of course, during COVID, right? Where if you have a lot of workers that are being forced to live together in small, cramped quarters, and we have a public health emergency where there's a spread of something that may be happening in an airborne kind of way, right? That's the housing structure is very relevant to that type of a question as well. And then I've also just been thinking about basic worker rights, right? Especially with a population that doesn't have a lot of bargaining power. If, for example, legal paperwork may be questionable in some cases. And so that's another vulnerability that's interrelated with this group that I've studied as well. As noted, COVID-19 provided a kind of an interesting case study on top of this. I've been studying health and safety in agriculture before COVID-19 and had some work that I'll discuss here. But then with the advent of COVID-19, some of my work actually moved towards thinking about that as a very particular health and safety shock relevant to this population, as it was to many others as well. So I want to think a little bit about COVID as well, and supply chain disruptions in the food production and food security of communities, and then some things about vulnerabilities of the population. So since I'm going to be talking about the case of U.S. agriculture, and since we're in a setting here where I have an international audience listening to this presentation, I want to think about some of the major themes and the major players that are relevant to the case of U.S. agriculture. So the first is consumers are, of course, an important part of any market, including an agricultural market. That they are the ones are eventually demanding quantities of these food products, right? And so in an equilibrium, we would have quantity demanded equaling quantity supplied, and we would have some equilibrium food price, and that's what our our consumer would see when they come to the store, and their well-being would be derived from being able to achieve baskets of these agricultural products at some kind of price that they find to be reasonable. And then producer experiences and supply chains are relevant as well for the case of U.S. agriculture, right? We care as well about the producers and whether they're making profits or not, and whether they're wanting to stay in the market or move into something else. And in the case of COVID-19, there were some pretty shocking news stories that came out for the U.S. that had to do with having to just get rid of surplus production in some pretty crazy ways, right? So, for example, dairy dumping refers to there were producers of dairy milk that were unable to get their product readily to market during COVID, and they ended up dumping all of their product, right? Just dumping it out. Or workers destroying their crop and just, mowing down effectively large crops and then waiting till next season because they don't have workers to pick those crops. And then in meat packing, there were a number of shutdowns as well and contagion events where workers who worked closely together. Meat packing is not done in an open air environment, but is done within an inside environment where there were spread of COVID and shutdowns and so forth. So there's a lot of producer experiences that may be relevant to thinking about some of the changes in recent history in terms of what's happened in agricultural work. And then I want to think about worker experiences. We have agricultural workers that have all kinds of different extents of vulnerability, right? We may have workers that are coming from different backgrounds, different language backgrounds, different cultural backgrounds that may face some extent of exploitation in these markets as well. And then also in the case of something like a COVID shock, our rural healthcare markets matter as well, because there might be some spatial mismatches between need and care. And so that's another area where there could be some big effects during something like a shock from COVID, as in government and public policy. There were some changes in terms of federal supports to agriculture, changes in terms of what was happening in food banks and school lunch programs, and then lots of remaining questions about what should have happened. So lots of normative questions about what should have happened and what should happen in the future if we ever have a shock like something like the COVID case again. All right, so studying U.S. agriculture and studying shocks related to COVID and other public health related questions for this population, there are plenty of areas of economics that are relevant. And so as you study economics, if this is a discipline that you're interested in, you might see some applications of regional economics where you look about physical space and economic outcomes. That's certainly relevant to large rural areas in agriculture. Public economics is also relevant where you think about public sector policies, expenditure and taxation, including things like health policy. Health economics would go deeper into health policy, so that's another area. And then labor economics is an entire field of economics that focuses on the worker and employment relationships and thinking about how workers are inputs to the production process. But sometimes we might also think about workers as needing their own inputs, right? Workers need something to be up to a level where they can participate in a market. And health and safety is definitely an area where that's very relevant, right? We need our workers to be well, to be able to work, right? They need to be well to be able to work. And then there may be differences in vulnerabilities across races, ethnicities, genders, occupations. Farm workers have some of these vulnerabilities and some concentrations of particular vulnerability and risk factor areas. Related to that, a large fraction of U.S. farm workers are Hispanic, often from Mexico or from Central America. They're often immigrant and they're often undocumented, which speaks to having limited bargaining power with their employers, and so may have less of a voice in terms of speaking up for their own health and safety and well-being. So in terms of some of the academic research questions that I've been engaged in, and starting from before COVID, but then moving into the COVID period, I was asking questions about how additional health-related protections for workers, so in terms of health and safety resources, could promote health of vulnerable workers and essential workers, while also minimizing costs to employers, to communities, health systems, and to the consumers in the food economy. From our discussion of our foundations of microeconomics, right, we're thinking about minimizing cost by choosing labor and choosing capital. So minimizing that cost subject to some production. And so that necessarily needs to be part of this as well. So how can we promote the health of workers while also minimizing costs, right, along a number of different dimensions? And so I have a co-author in some of this research, Dr. Myung Fan. He's at Ball State University, which is also in the United States, but in a different part of the country. And he and I have worked on examining health profiles and work environments of U.S. farm workers and some of the trends in healthcare access to understand risk factors to essential workers, to food supply, to these health systems as well. And we argued in that research that farm workers are essential employees. And during COVID, for example, farm workers largely continued to work. Right? They had to keep working. They were deemed essential employees. And so while some of us were told to go home and work remotely and turn on Zoom, right, and have our meetings and keep teaching our students and so forth, farm workers who are picking crop and working in dairy production and so forth were told that they were essential and should continue to work. Now, some workers did continue to work. And some workers stopped coming because of some of the things that happened with these immigration channels. And all of that led to this situation where we had some supply chain breakdowns, like the ones I was previewing about the dairy dumping and the having to roll over crops and so forth. So workers in this industry are essential employees who maybe continue to work during a health crisis, right? They're also seasonal workers, and so that compounds the pressure on workers and farmers, making this a particularly interesting group to study because the timing matters a lot in agriculture. So whether crops are picked on time, right, or milk gets to market on time, right, and gets pasteurized on time, these things are very time sensitive. So the seasonality of work compounds the pressures on having people work quickly and close together. And so that was definitely a big question in our COVID environment. Also, spring and fall, when COVID started, were particular critical times in the annual work cycle for crop agriculture as well. And then there were all these aggregating factors, some of which I alluded to, that U.S. farms don't always have the best sanitation. There's not always access, for example, to water for hand washing. There's not always access to things like toilets out in the fields or near the fields. And even though some of these things are required by law in the United States, the enforcement tends to be quite low in a lot of these cases as well. Right. And there's also limitations in housing. And so that meant that recommended social distancing in agriculture during COVID was difficult to do as well. Our U.S. regulatory standards include access to a toilet and a hand washing facility within a quarter mile for each 20 employees. If the workers are working 3 hours at a time and the employer has more than 10 workers per day. So there are some rules about this, but they're not always followed. And so I have some previous work with a different co-author that's documented here where we looked at limitations in terms of hand washing ability, and found that international workers who have lower average education and English language ability and a self-reported English language ability were most likely to experience sanitation risk exposures, even into the current period, right? And that current period was being defined at that publication date in 2018, right? So we had workers still experiencing sanitation exposures. And then poor housing conditions, cramped living spaces, especially for migrant workers who often live in group quarters or camps, that would minimize the possibility for a recommended amount of social distancing. So from a theoretical perspective, when we think about economics and public health, there's an academic literature that documents correlations between poor health and low labor productivity in some different contexts. That low productivity can be associated with lower wages. And so that relates to this theme of prices that we see in our models of economics. Poor health status also may be associated with low productivity. And some of the measures that come out of the academic literature are to look at absenteeism and also presenteeism. And absenteeism is missing labor hours that may be due to having a certain health condition, right? So you're sick, so you're absent from work. Whereas presenteeism is that you may be at work, but you're actually sick at work. And so even though you're clocking labor time, you're maybe not doing so in the most efficient way possible. So this is also what we mean by labor is an input to the production process, but labor itself also needs its own inputs, right? Labor needs to be healthy, right? For example, or it's not operating at full capacity. So if that's the literature that's relevant, that's coming from the more economics and social science side, there's also literature that comes from the medical side, the medical literature that's relevant as well. And so pre-existing health conditions are associated with higher probabilities of negative health outcomes. And early assessments of the pandemic documented that there is increased prevalence of COVID-19 among minority, racial, and ethnic groups. And so if we saw that something like COVID was having more of an effect on certain groups, but those certain groups are also more highly concentrated in some of the labor markets that we're thinking about, right? There's all kinds of correlations that are relevant for exploring. Right? So in some of the analysis that I did, I worked with the National Agricultural Workers Survey, which is a worker survey in the United States that's conducted in 3 seasons per year. It's been conducted since 1989 by the U.S. Department of Labor Employment, and the U.S. Department of Labor and the Employment and Training unit of that, administrative unit of the Department of Labor. And the data collects a wide variety of demographic and work-related characteristics, and it's both nationally and regionally representative for agricultural regions in the United States. And the data set has a lot of information on workers who are employed in crop agriculture and are not temporary agricultural workers through the H-2A visa program. So these are workers who have come through a number of different channels, but are not official temporary ag workers through that program. There are other people who have showed up to work in agriculture. And it's a large data set. And so the data set as it existed through 2018 that was used for a COVID analysis during COVID period to think about the vulnerabilities, there were 69,000 observations in the full data set, and we used 45,000 of them in our analysis. So this was a large data exercise and another example of big data that you can use in economics. And so we examined factors that related to pre-existing health conditions, the availability of healthcare and health insurance, demographic and socioeconomic characteristics, and then field sanitation and housing quality were things that we took a look at in this. And we were asking questions that were pertaining to what would be the predicted or anticipated impact of this COVID shock that was happening at the time on this particular worker population, which is highly Hispanic, highly immigrant, and economically vulnerable within the United States. So the particular data that we were using, there were some self-reported accounts of medical conditions. This was relevant to COVID because the doctors at the time were saying that there were certain pre-existing conditions that were related with worse outcomes in terms of COVID. So asthma, diabetes, high blood pressure, tuberculosis, heart disease, urinary tract infections. And the question, particularly in terms of its language, was, have you ever in your life been told by a doctor or a nurse that you have the following conditions? And then the list of conditions was that list that I just read to you. And so those diagnosed conditions, that could be a function of the conditions themselves, but it also could be a function of the availability and usage of medical care because of the part of the question that's asking, do you know this for sure? Like, has a doctor or nurse told you, right? Only a doctor or nurse would tell you if you had gone to a doctor, right? So the availability and usage of medical care was interrelated with this across different workers. And so we considered quality and access to healthcare with these questions. If you're injured at work or get sick as a result of your work, does your employer provide health insurance or pay for your care? And then we also looked at a question that had to do with, within the last 2 years, has anyone in your household received benefits from the following program? And the program was the public health clinic, which is available in a lot of these agricultural communities, but may or may not be used readily. And then on the sanitation side, we used questions, information on, does your employer provide water to wash hands? Does your employer provide a toilet? Does your employer provide clean drinking water and disposable cups? And then on the housing side, right, in what type of living quarters do you live now? Your housing structure. And we coded vulnerable housing as being related to living in a mobile home, a dormitory or barrack, campsites or tents, or being without housing. So we kind of split up into housing that we thought was better quality and lower quality, and created an indicator for a lower quality or some kind of risky relationship in terms of housing. This is what some of this data look like, right? Didn't mean to move that yet. This is the population 2000 to 2018. So this was the pre-COVID period where we were assessing the vulnerabilities. And we were looking at trends in average age, which you can see that there's clearly an increasing trend where workers are older and older. And if you restrict to workers who are 50 or older, that's increasing specifically as well. And then we looked at healthcare market participation, and it did look like workers were in recent periods reporting that they had health insurance at higher rates than they had in the past, and reporting that they had visited a public health clinic at higher rates than they had in the past. And we found that that was important to note in terms of thinking about impacts on public health systems and public health clinics, right? Because if you have a large shock from something like COVID, and you do have workers that know about the clinic and do have insurance, you're probably going to get some big hits quickly, was what we were predicting as well. And then we reproduced this looking at age and healthcare participation by migrant stream, because we recognized that our migrants in the United States tend to come into the country at the southern border with Mexico. So they come from Central America or Mexico. They cross the border, they work at a farm in the southern part of the United States, and then they start following the crop as the season progresses. So the weather conditions are such in the US agriculture, that the crops are ready to be picked earlier in the south. And then as you go north, this happens at a later time period and a later time period because of the weather. And so the same group of workers can start at the southern border and then can finish up and then move to a more northern location and then finish up and then move to another northern location. And so we looked at the East Coast versus the Midwest versus the West Coast to see the streams of workers going up. And we actually found these patterns were very robust across those regions, but there were some regional differences in this as well. In terms of looking at some of these pre-existing health conditions that were relevant here, we can see that in the raw data that there's an increase in workers with pre-existing conditions as we move over time. But keep in mind that our workers were also getting older. We noticed that in the previous graph. And so we also did an age standardization to see kind of if we netted out the impact of age, what that would look like. And it still looked like an increasing trend towards reporting different pre-existing conditions. Also for having health insurance and specifically for having asthma, diabetes, and high blood pressure, which were specific problems that were indicated by doctors early on in the COVID pandemic in terms of being particular risk factors. So we have these pre-existing health conditions that are increasing. They also increased here for the migrant streams, though there was some variability and some more noise in the series for the Midwest than in the other two series. But we saw all those patterns were very robust. In terms of work and housing risk factors, we looked at those poor living conditions. And then we looked at that also conditioning on pre-existing conditions. And we didn't see any patterns that were too striking in any particular direction. We certainly saw some noise and some shocks that were happening around the Great Recession period, 2008, 2009. But we didn't see too much that really indicated clear trends in the later period. So it ended up kind of a question mark for us, how the living conditions and the sanitation availability, whether those would be mitigators or not in our statistical analysis. So given that this is not an econometrics lecture, I didn't want to go through the full statistical analysis that appeared in that paper, but I did want to summarize some of the findings. And so we found that there was an aging workforce alongside increased access to healthcare. And there was also higher reported incidence of risk factors such as diabetes, asthma, and heart disease. And so it really confirmed a vulnerable, marginal, and essential workforce. And we had some limits to field sanitation and housing quality that could potentially inflate the overall risk of different hotbeds for COVID-19, further compromising worker health and rural health capacities and the agricultural supply chain. But those mitigators were not perfect predictors on their own, as we just mentioned. And so this had implications also for healthcare facilities, making sure to have proper technology to deal with severe respiratory ailments, often distance to cities. Facilities were often located distant from cities. And so the potential for there to be some significant capacity constraints in terms of healthcare was definitely there as well. And a likelihood of strain to the healthcare system as there was transmission as well, and workers seeking out care with their health insurance. And so we ended up concluding that there was an economic impact of new strain on supply chains that would be related to worker absences, especially given what was happening with the early disruptions and some of the things that we were seeing in the market. But a lot of this work was ultimately fairly speculative because it was conducted right at the beginning of COVID while we were looking at risk factors to see what would really happen. And so continuing work has looked at what did happen, right, as opposed to what could happen. In both sets of work, we're looking at demographic factors, health conditions, work and housing situations as interrelated factors, and thinking of this as a complex problem, and also thinking about this as a public policy problem where there may be worker protections that minimize long-run health costs, additional protections in terms of improved field sanitation, especially hand wash water was something that we really promoted at the time, and really looking into housing and how congestion in housing could be related to health and economic costs as well. So those seem to be great areas for investment. And also this was research that identified demographic and work-related characteristics associated with risks that could be used for very particular policy targeting. And we really saw this as a way for, as epidemiologists, really develop the risk profiles of different groups, that this large worker survey type data analysis could be used for figuring out some optimality in terms of distributions of things like PPE, personal protection equipment, so masks and hand wash, and different things relating to sanitation, hand sanitizer and so forth, among the possible intervention for this population, with, of course, specialized guidance from the group itself and from people who are on the ground working with this very vulnerable population. Right, so that was a research project that I was involved with for a bit of time. And it was interrelated as well with thinking about what's happening in supply chains in agriculture. And I previewed that idea before, and I know that some of you have a business background, but so that everybody's on the same page, I wanted to define supply chain so we have a common definition. A supply chain is an entire system of producing and delivering a product or service from the beginning stage of sourcing the raw material to the final delivery of the product or service to the end user. So from that point where we have those inputs to the production process that we were thinking about, all the way up till we have that final quantity of product that we're bringing to the market, right? So the supply chain lays out all the aspects of the production process, including the activities involved at each stage. That information is communicated, natural resources are transformed into useful materials, human resources and other components that can go into the finished product, right? So that's a definition of a supply chain. And in the context of agriculture or agro-business, we sometimes think of that as everything that happens between the farm and the fork. So everything that happens between the farm that's producing the food and the food being on the table where you're ultimately eating it is happening in terms of the agro-business supply chain. So when we think about our supply chains, we could think about demand, consumer demand going into raw materials and supply to the manufacturer, to the distributor, to the retailer. And consumer demand for different products certainly increased quite a bit during the COVID period. So that increase is showing that. These big red X's are showing that we had bottlenecks for various inputs at all of these different places within the supply chain, right? We had all of these bottlenecks occurring. And it wasn't just in one spot, right? But I have it 5 different places in terms of this diagram. And so here are some headlines that came out of some of the media that showed some of the things that were happening in the United States during this period. So farmers dumping milk, breaking egg. We have restaurant closings destroying demand. Those were all breakdowns of the supply chain at the time. President Trump's executive order didn't stop the meat plant closures, and 7 more shut this past week. So we had all of these problems with contagion in meat production. Getting healthcare was already tough in rural areas. The pandemic made it worse. The virus's unseen hot zone was the American farm, right? We are having problems in terms of farm workers who were infected. The virus represented a growing problem there. And then for that dumping that I was mentioning, the milk dumping, the supply chain breakdown, we could really think of it in terms of this picture, right? So this picture is the case of a producer in milk that's literally standing there dumping out his product. But this picture was a picture of the milk dumping that I was mentioning, right? So this is a producer at a dairy farm just dumping the milk out because he was unable to get it packaged and ready to go to market at a ready rate. And so this was basically a destruction again of agricultural product, right? So the media accounts are highlighting all of these things, this mismatched supply and demand, the closure in some of the industries, all these producer stories, and the producer was a big part of our model. And ultimately, prices would adjust, or prices should adjust, given what we learn about in our markets, such that demand would equal supply. So a next step of this is to say, well, given that COVID, we're now in kind of a post-COVID or a late COVID period, the extent to which we have long-run impacts on farm labor force, employers, rural communities, food supply, and consumer prices, a lot of that remains uncertain, right? We talked about the vulnerabilities, and we're able to very clearly detail what those vulnerabilities look like. But there was a lot of anecdotal evidence in the media about the actual impacts on the size and the composition of the farm work population and on other aspects of agriculture. But this remains relatively understudied as the early evidence, like what I was showing you by myself and my co-author, were on hypothesized effects as opposed to actual changes. But I actually have a new paper that's literally out last month in Journal of Labor Research that looks at labor impacts of COVID-19 in U.S. agriculture from a slightly different perspective by using data from the current population survey in the United States, which is not a farm work survey overall. It's actually a survey that's of households more broadly across a large number of industries and occupations. The ag workers are a much smaller subset, and they can be approximated but not perfectly identified in that data. But I did the best I can and made some judgment calls working with that data to see what we could learn about what some of the actual impacts may have looked like. And so this is a table from that, and I don't want to spend too much on an econometric table, but I looked at the determinants of the probability of being unable to work during the pandemic, right? So the probability of being unable to work, modeling it as a function of a number of demographic characteristics for those in crop production and animal production is what's occurring here. And one thing that I will note in this is that Hispanic origin is highly statistically significant and positive in a number of these specifications, most particularly in crop production, and is a statistically significant and economically significant determinant of the probability of being unable to work. And so whereas some of the other things, right, like having more children in the house, being unable to work, that makes sense in terms of things that were happening in terms of homeschooling and care responsibilities, right? We have a story for that. But when we look at things that have to do with Hispanic origin, holding all else equal, that's a little more questionable as to what might be occurring there and whether there might be something that's happening more on a discriminatory dimension or something that has happened in an unequal way across members of the population. And so what this research is certainly suggesting is that the actual impacts of the pandemic were very different across people in different racial and ethnic groups. And I think that's very relevant for understanding the targeting of health programs and also some of the safety programs that happen as well. In a complementary report, OSHA in the United States that provides guidance for employers, so occupational safety and health administration. They provide guidance rather than requirements for ag workers, for ag employers. And some employers refused to offer testing, or they threatened retaliation if workers sought testing during COVID, right? They didn't want workers to find out that they were positive, because if they were, then they could no longer work. And public health officials have been resistant or reluctant to control or respond to outbreaks among agricultural workers. And so this is a report coming from a government agency that's indicating that there were some significant problems that targeted a population that also had some characteristics of questionable legal status and very low bargaining power in terms of the employer and employee work relationship. And so in the context of this health crisis, there could have been some significant exploitation that was occurring as well, right? So housing conditions, again, in question, access to hygiene for hygiene prevention in question as well. Some of the policies that did occur for the agricultural sector during the pandemic included food assistance programs. There was direct support given to farmers and ranchers. And so when we think about producer well-being and firm well-being, there were some direct payments that were going to those firms to support them when there were losses, when there were things like that dairy dumping that we took a look at. But it's not clear that that money was passed through to workers themselves in terms of ways to deal with the health crises that individuals may be experiencing. There were purchase and distribution programs that were interrelated. So there were partnerships with regional and local distributors where the workforce was closed for restaurants and for hotels, for food services, to purchase some of that excess product. But that was, again, a response that was largely helping the owner operators as opposed to the individual farm workers, right? So setting up procurement relationships with fruits and vegetables, for example, dairy products and in meat products, and then distributing those products to food banks, to faith-based organizations and nonprofits. So getting that to consumers in some way, but largely, again, bypassing the question of what was happening with the workers. Right, so food banks, flexibility and waivers to ensure food got to kids and families, and meals, school meals when schools closed was another thing that was set up in a lot of areas in the United States as well. Lots of supports for consumers. When we think about what the potential supports were for workers themselves and whether or not they were properly targeted, there were some regulatory responses, but it was mostly CDC worksite type guidance that was very generic as opposed to agriculture specific. There were some recommendations for things like cohorting, keeping workers separate in their vehicles and in their housing. So some things that maybe were more obvious, but without resources behind them. There were some statements that came out that suggested that owners and operators should develop an assessment and control plan, but again, not necessarily with resources backed at a federal level. But at the state level, there were some interesting policies. There were 11 states. I highlight Colorado, where I am, because that was a particular state as well that introduced some mandatory protections for workers. This was not universal across the country, but in some areas there were some protections for workers that included requiring PPE and physical distancing, disinfecting different workplace spaces and allowing for testing. And there was some emergency quarantine housing that was set up in some locations as well. And a few places added some funds to pay for lost wages or assistance for workers themselves who were affected by COVID, but that was not across the board in that case either. There were continued inspections, grading services throughout COVID, added flexibilities in labeling of different products, and some loan flexibilities, deferrals, and maturity extensions that largely affected the farm operator owners, again, as opposed to the workers. But there were some other things that were set up to smooth out the response. There were some grants given for telemedicine for rural America to try to maintain health care even in rural locations. And there are, of course, lots of areas within where this fits into economics as well, and economic problems in ag communities and rural communities. The spatial mismatch between need and care is something that was certainly experienced and something that was previewed at the beginning. And so as a result of that, there were some grant programs that were set up to get money to small rural hospitals to improve them, improve safety responses, and maintaining the operations. And then there was some support again for those telehealth resource centers, especially in terms of tech support and getting the equipment and the payment policy and the system design quickly to be able to allow for all of those. So I think all of this speaks to some of the things we can do in a health emergency when we need to deal with a number of health and safety issues for workers. But it's largely a normative question as well about what we should do to protect vulnerable food, vulnerable producers, and mostly the vulnerable workers, because that seems to be a group that is often underserved in this capacity. And so I think there are some things that we learned from this pandemic and from the policy response, but I think there's also some future targeting that could be done, and some of the statistical analyses and statistical frameworks that we now have developed could be used if something like this were to happen in the future to help direct some of this public policy. All right, so that was actually where I was trying to get for this first part, right, of the seminar series. And so I'm going to stop sharing here and ask if there were any follow-up questions that we should address now before the second session. Or we can certainly wait to the second session too. That was a lot of information, right? Very quick. Information on the theory of economics, how it applies to a number of these issues. A lot of information on a case study for agriculture. But the third part of this, which is going to be in the second lecture, is really going to be to think about bringing the ethics more. And so I think that'll be an engaging area for questions as well. All right, so I'm going to suggest we take our half-hour break. I'll make sure to charge up my computer here, and we'll come back for the second part.